I didn't understand what was going on with her. Something was wrong, but I couldn't put my finger on it. To watch her go through this was painful because you really don't know what's going on. You want to help, but you don't know what to do. It's just not normal.
Hair shedding was one of the symptoms I had, which was very disturbing to me. I got really depressed, and so I spent most of my time at home because I was afraid to go out. It's very embarrassing, to be quite honest with you. It's very embarrassing. It's like it was just taking the life right out of me.
I realized there was an issue there, and it was always that anxiety that was frustrating for me. Just wasn't normal for me.
I didn't know what it was, but I know my body well enough to know that there was something wrong.
It got to be a big problem, and I'd literally have to be in the bathroom every hour. Emotionally, that was not very pleasant at all. It just sort of is a depressing sort of thing for your whole life because it sort of just stops everything.
I had to have a blood transfusion, 4 units of blood, and almost could have died.
She opened up and she showed it to me. Like she said, "Peter, come in here," and I'm going to the bathroom, and she's in the toilet, and she's like, "I need you to look." And she would show me, and I was like, wow, it's like clots of blood.
I was exhausted. I did not feel like doing anything. Everything was a struggle. And I always have to look like everything is great because of what I do. And inside, I always kind of felt like I was living a double life.
They suffer in silence. Through their discomfort, they suffer. Through their shame, they suffer. Through their weakness, they suffer. From pain, embarrassment, living a life of restriction as if they were imprisoned in their own world. These women suffer. They are women who dare to tell others of their condition, not knowing what people would think, feeling as though people wouldn't understand, wouldn't even comprehend the hardship, the distress they experience. 1 in 3 women can relate to their stories and have been where they've been. These are just a few of those stories of the women who suffer in silence.
Uterine fibroids are the most common pelvic tumor in women. They're benign, they're not cancerous, but they're the most common pelvic tumor seen in women. The symptoms most commonly are heavy menstrual bleeding, pelvic pain, increased urinary frequency. Usually women between the ages of 30 and 55 can suffer with these fibroid tumors.
I remember once I was at my niece's graduation, and my period was on, and it was just extremely heavy. And it was just like a water faucet. I reached my point when 1 month, literally for the entire month, I had a period. And it was heavy the entire time. I was like, okay, something is wrong.
I actually got diagnosed with fibroids early on, actually, right after I had my first child, my daughter Noelle. But it wasn't an issue. They were very small, they weren't really affecting me in any way.
My fibroid-related symptoms were excessive bleeding, cramping, and long periods. And my periods became irregular. And then my turning point was when I bled for 1 month straight.
I was severely anemic. I suffered greatly with profuse bleeding every month, and it was just ruining my life.
My fibroid-related symptoms started around 2013. I started having a lot of heavy bleeding on my monthly periods. My periods were running like from 7 to 14 days, and I thought that was kind of odd, but I really was very concerned about it at the moment till later on.
Well, I first felt like something was wrong when my periods became somewhat inconsistent, and very long. Mine could go a month and a half, 2 months. I also had some backache and things like that, which just wasn't normal for me.
The first time I noticed a problem was when my cycle was really heavy and being limited to staying at home for 2 days while that heavy part of the cycle happened. And that's been going on for about 10 years. It was scary because what is that? You know, where is it coming from? And are you gonna die? Are you gonna bleed to death? I mean, you feel like you're hemorrhaging. So it was really frightening.
I first noticed something was wrong when my monthly cycle was extremely heavy all of a sudden, and I experienced extreme pain in my abdomen. It was the most excruciating thing that I've ever felt in my life. It would immediately hit you like a bolt of lightning, and it would seem like the pain would take your whole insides and just churn it and squeeze it and just push it, and it was hard.
I was urinating 9, 10, 11 times a day, could not hold any liquids, and knew that there was something wrong.
Uterine fibroids have plagued the lives of millions of women nationwide. Many of them have experienced this condition all of their adult lives and continue to suffer in silence. Why silently? Well, for many, the condition is embarrassing to talk about. For others, their physician has given them only one treatment option, one that is completely unacceptable to them. Who can they turn to, and where can they seek help to treat this often disabling condition? Many women seek medical advice from their gynecologist, the first choice, of course. But many of these respected doctors have given them only one option, an option that would alter their lives forever, and typically not in a good way. That choice of treatment was a hysterectomy. Now, this could compromise their sense of womanhood, motherhood, and sexual activity. It can also cause various complications after surgery. Hysterectomy also has a long recovery, with patients missing up to 2 months or more from work. But there is another procedure that many gynecologists don't offer their patients as an alternative treatment for their uterine fibroids. This procedure has been available for many years, and it is known to be very successful. A procedure which is completely non-surgical and treats all of the fibroids in a woman's uterus. An outpatient procedure where the patient leaves with just a Band-Aid and returns to work in a matter of 5 to 7 days. This procedure, UFE, uterine fibroid embolization.
They get these episodes of blood gushing out, flooding, large clots. They're often anemic, and anemic means that they have a low iron and low hemoglobin, and the result is that they get very tired, they're weak, they may get lightheaded or dizzy, their heart races because they have less circulating red cells, and so their heart has to beat faster. They might chew or crave ice. That's a common symptom. They may get migraine-like headaches. We've seen patients with been on migraine medicine. They don't need migraine medicine. They have fibroids. They just need their anemia fixed.
I was exhausted. I did not feel like doing anything. Everything was a struggle. I was never in a good mood. I just, always wanted more sleep. My energy level was always low. I mean, I never ever felt like getting up doing a scene for the past 3 years, it felt like, until I had the UFE procedure.
I would sweat. I would become hot. And I couldn't move, and I couldn't breathe. And I knew it was unnatural, and something had to be done.
As a female in a male-oriented industry, I was always kind of concerned that I'm going to have a really embarrassing incident in front of a conference room or something like that.
To be sitting, say, in a meeting, you get up to go to the restroom, and there's blood in the seat. And it's just so embarrassing, and it's like, I just can't do this anymore.
We've seen lots of women with hair loss, worse than mine, and it's reversible. And all they needed is their anemia corrected and their hair grew back. But no one ever told them it was due to the anemia from their fibroids.
I had one of the best vacations and one of the worst vacations when we went on a sailing trip to the British Virgin Islands. And of course my period started about the first day we were really on the boat, and it was a small sailboat. I was trying to hide from everybody that I was having this problem, and yet I needed to be near a bathroom every hour in a bathing suit. So needless to say, there were a couple of incidents because I was in the water snorkeling and swimming, and you can just leave that to your imagination. It was embarrassing and awkward.
My husband and I were at a concert in Greenville. It was an outdoor sort of festival. We were sitting on a wall, and I had a light green skirt on, and I stood up from the wall, and it was just like waterfall, just gushing blood everywhere. And the two of us had to run through 3 blocks of people just to get back to the hotel, and it was just one of the most humiliating experiences in my life.
It was really the most embarrassing moment of my life, and I think even more so Peter's life.
We were in Portland. We went to do a Bravo event.
I just lost track of time, and then I remember us being at dinner, and I remember after the dinner was over, I remember standing up to leave, and all of a sudden I just felt like a child or something just fell in my underwear. It was crazy. I just felt like this big, overwhelming something that came down, and what it was like blood clots.
She had the dress on. It was coming down the dress and down into her shoes.
What ended up happening was I did walk out of the restaurant, and the whole time I'm walking, I'm feeling actual blood running down my legs, and I have on a beautiful evening dress, short. And by the time I got to the elevator, I was like literally standing in a pool of my own blood. I'd never had a clot that big before.
And some people was coming in the elevator. I had to like back them out because at this time there's blood all over the floor in the elevator, and it was just bad.
The hardest part was, people aren't even looking down at me. They're looking at like, hey, can we get a picture? You can't be like, girl, I'm bleeding to death right now.
It was extremely embarrassing, and we had to walk around another 50 yards to get to our room, and she was dripping. So I just called them as soon as I get to the room and explain to them what happened.
I just remember saying, enough is enough. I don't know what you gotta do, but you gotta do something.
Their whole life is revolved around their menstrual. Oftentimes they don't work a couple days a month, and even when they do venture outside, they got to know where every bathroom is, they got to carry extra clothes. Everything they do revolves around what time of the month it is, and it's very disabling.
My main focus was to make sure that she was healthy and well, because she's my better half.
Sexually, there was no sex, to be quite honest with you, because I was bleeding so much, and he was so very concerned about it that he was very patient with me, but it made me feel really bad as a wife to him that I couldn't take care of him the way he needed to be taken care of. So it really affected my marriage in that way. It made me feel bad.
My husband is very patient. We've been married 33 years this year. But he could tell when my period was about to start, and he'd just roll his eyes. Oh, here we go again, because couldn't go anywhere, it was heavy, interferes with your sex life.
One woman is bleeding that heavy. There's nothing sexy about that, you know what I'm saying? So of course she's not feeling sexy. Her having fibroids definitely takes a lot out of the sex life for the fact that we just don't do things that we used to do. We're doing more cuddling than anything else.
Mommy?
Yes?
Is this the queen?
Let me see. I don't know if there's a queen in that one. That's a monster. My gynecologist discovered that I had the fibroid tumors during my first pregnancy. And I did end up having a miscarriage at 18 weeks. And my gynecologist thought that was probably the primary reason for it. So myomectomy was an option that they gave me to deal with the fibroids.
My OBGYN performed a myomectomy for me in August of 2014. And I thought I had corrected the problem, but when I went back in December of 2014, I was still having some bleeding, and he indicated to me then that I had a fibroid in the lining of my uterus.
The fibroids were probably causing her not to be able to carry a child to term. We've been trying to have children for 29 years.
His treatment for the fibroids was to have a hysterectomy, which was very upsetting to me at the time, so I didn't go back to him.
I had this procedure called laparoscopic surgery. Okay, everything worked fine for a couple of years, no problems. Probably maybe 2 to 3 years down the road, I started having the same symptoms, heavy periods. Went back to my gynecologist, and he said, okay, well, yeah, the fibroids have came back. There's another procedure that we can try. So we did the myomectomy. Probably 2 to 3 years, fibroids are back again.
My gynecologist told me about a form of birth control that would help my period flow, and that didn't work for me. That was kind of a nightmare, actually.
I felt it was something larger than just going to my OBGYN. It wasn't anything that my OBGYN would do other than prescribe pain pills.
I called my specialist and she referred me to another specialist because we thought it was something different. And then later we found out that it was fibroids. I was looking for a really top-notch gynecologist. Was given the name of a top-notch doctor here in the Atlanta area and went to visit him. He scared me. He told me that I had fibroids, lots of fibroids, and that he could not feel my ovaries. He received the report 3 days later, called me back in, told me that I needed to get a hysterectomy right away. I just felt really, really scared and really, really unsure. And so I didn't go back a couple days later. I went back a week later. And he had actually scheduled my hysterectomy. I just want to talk a little bit more about it. And he said, well, I already got you scheduled, and I just think this is the best thing for you. And I said, okay, I understand that, but are there any other options? He turned around and walked away from me with his back to me, with his hand on his hip for about 5 seconds. He turned around and looked me in my face and said to me exactly, well, there's some other options, but for you, this is the best option. And really, you don't have to do anything at all.
The gynecologists don't perform this procedure. They're not trained in doing UFE, so they can't provide that solution. But that still shouldn't abdicate their responsibility from telling the patient all the options.
The treatments that I tried before UFE were numerous. I read so many articles. My main objective was I did not want to get rid of my uterus. I did not want to have a hysterectomy. So I tried alternative medications. I tried fasts. I tried different types of juices. I tried different types of herbs, acupuncture, everything that I could think of, because the only medical decision that I was faced with involving my fibroids was a hysterectomy, and that was not the way that I wanted to go. When I was trying to seek treatment in other places, I just felt like I was being dismissed. I oftentimes felt like it was my fault that I had fibroids, that I was wasting people's time, because I was trying to figure out what I was going to do and not have a hysterectomy, and that was the only answer that I was getting. And on top of that, I was fighting for my fertility, didn't want to not be able to have children, and I was just being told that, you know, this was the final option for me.
My gynecologist told me that I had no other alternative. Told me that I had to have a hysterectomy or a myomectomy, told me all about it. I even called her a couple times after she told me that. I said, there's got to be something else. She said, absolutely not, there's nothing else. And we scheduled the surgery. Come to find out later, not only did she know about that procedure, but she knew Dr. Lipman because they had worked in the same building together.
Get a second opinion. You need to hear about UFE. UFE is one of the biggest medical breakthroughs for women suffering with fibroids, and yet most women have never heard about it. It's our belief that most women that go to their gynecologist never hear about UFE, and they really need to. Hysterectomy is the second most common surgery performed in the United States. 3,000 women every day in this country have a hysterectomy, and 3 of them don't survive the surgery.
I went to 3 gynecologists, and of course they were wonderful people, but they wanted me to have a hysterectomy. One gyno said that I needed a major abdominal surgery to take my uterus out, and I wanted to keep my uterus. I believe it is important for a woman. It's an integral part of our body, and I feel as women we have that right to seek other options.
Every year I would say, so what are we going to do? And we would wait for menopause. That was my option. Until 2014, when I went in, he decided that my fibroid had grown and did an ultrasound to take a look, and it had grown, and he told me that if it hadn't shrunk by December, that I would need to have a hysterectomy.
Well, patients will come into the office. Usually they've been suffering with symptoms of fibroids for a long time, because unfortunately most women never hear about UFE. And so they will suffer. We call them the silent sufferers. They don't want hysterectomy, and they just kind of live with the horrible symptoms of fibroids: heavy menstrual bleeding, pelvic pain, urinary frequency, and they kind of pad themselves up and kind of live with it.
You know, I think we're all taught or conditioned to believe that doctors know everything, but for someone to not tell me about this procedure that did help me or could have helped me, even if it was only 90% effective or whatever, it made me, first of all, I was very angry at first that I wasted all these years with the same doctor not telling me that I could have this procedure. There are consequences to having a hysterectomy, and I don't want to have to do that if I don't have to. It's like we're living in the dark ages if we're not going to tell women about this and let them know that they don't have to. There is another option. Why does someone else get to decide what happens to my body when there was this other option? That to me was the biggest factor that made me angry about the whole thing of not knowing about UFE, because why does someone else get to tell me this is your only option when actually there's another option? That to me made me mad too, as a woman.
You hear about fibroids, but you don't hear about how detrimental they can really be to women. And so to have people not knowing and not understanding that this can be a very detrimental condition if nothing's done about it, and that there are options, there are alternatives to hysterectomy.
Fibroids are benign tumors, they're not cancer. If we were talking uterine cancer, hysterectomy is appropriate. But for fibroids, it's not necessary. You don't need to lose your uterus.
I was working an event where Dr. Lipman was promoting his services. So I actually met him, and I decided, let me call Dr. Lipman and get a consultation, because the pain was destroying my life. After a year of this embarrassing situation, so I thought, I decided to go and make an appointment and get a consultation, and that's when I found out that this would be a great procedure.
I had prayed that, I'd get an answer for this, because the answer that my doctor gave me was unacceptable to me. And I was watching the television show, The Doctors, and fortunately for me, Dr. Lipman was on that show that day, so I decided to call his office.
The way that I learned about UFE was actually by accident. I was a member of a social group, and one of the ladies in the group, she was also struggling with fibroids, and she had heard that Dr. Lipman was giving a free seminar, so I just went to just listen to what he had to say.
So one day I was reading the Atlanta Business Chronicle, and a headline caught my eye that said something about fibroids, and so I stopped. It was an award that they gave to Dr. Lipman for his technique for UFE. And I thought, what is this? I read the whole article. I got online, started doing some research, and made an appointment with Dr. Lipman within the month.
I went online. I started researching alternatives. I looked at some herbal remedies. And then I found Dr. Lipman. And after reading his reviews and doing the research and finding out actually that Cynthia Bailey, that was probably the draw.
I was so glad when she met Dr. Lipman and he said he could do the procedure. I was so happy because we wanted to really close that out. There's nothing nice about that.
When I was finally at a point where I just couldn't take it anymore, my gynecologist referred him to me.
Well, hopefully doctors will explain all the treatment options. It's called informed consent. Before they consent to a particular treatment option, a patient should know all of the treatment options available to them, and then they decide what they want to proceed with. It's not, I'm the physician, you're the patient, do what I say. That was kind of a previous era. Today's medicine should be, we're working as a team together, and I'm going to come in with information. I'm going to ask my doctor, these important questions about my health. And if you have fibroids or think you might have fibroids, discuss that with your doctor. And then, at that visit, arm yourself ahead of time with information.
My gynecologist gave me the brochure that had Dr. Lipman's name on it with his website and told me to read up on it. So I did and just read everything about Dr. Lipman's procedure. And I was like, I've tried everything else. I might as well give this a try too.
I started researching the procedure on the internet. I found Dr. Lipman's name online, and it was clear that he'd had lots of experience, and the doctor who had had the most experience in doing the procedure. And being here in Atlanta, it was a natural choice for me.
The fibroid embolization procedure was discovered by accident. We've been embolizing tumors for a long time, mostly for cancer tumors. To make it an easier surgical operation, they would first be embolized with an interventional radiologist like myself, and then go off to surgery. And when these tumors were embolized, it's cutting off the blood supply to the fibroids. But a group in France got the idea, why don't we do that for fibroids prior to their hysterectomy and make it an easier hysterectomy? Even though fibroids are benign, they're not cancer, they are very vascular tumors. France has a different medical system than we have here currently. It's more socialized medicine. And so you wait 6, 7, 8 weeks for your elective surgery. While they were waiting, their symptoms went away. And so the patients would ask their gynecologist, do I still need to have that second part? Because I feel great, my symptoms are gone. The group in France, the gynecologist called UCLA and said, this is really interesting, you better look at this. And he got the interventional radiologist, Scott Goodwin, who worked at UCLA with him at the time, to do the first patient in the United States. I've done well over 5,000 UFE procedures.
If a woman can avoid having a hysterectomy that changes the rest of your life, why not try this first? For a woman that's only in her 20s or 30s, I feel it's almost barbaric to say that a hysterectomy is your only option. It's certainly not being told to us by the medical profession.
Every patient has had an MRI of their pelvis because oftentimes they've had ultrasound, and ultrasound is okay to diagnose fibroids, but we need a much better, higher resolution look at the pelvis. Because sometimes, surprisingly, patients that have been told they have fibroids don't actually have fibroids. They have other conditions that can mimic them. They have fibroid-related symptoms, and then the symptoms and the fibroids fit on imaging. I'll show you a picture of someone that had the MRI recently. These particular ones here on this screen are taken from the side view. So the front of her is on the left-hand side of the screen, and you can see her spine and back on the right. And then all of this is uterus. Her uterus is much larger than normal, and normally the uterus goes from about here to about here. Everywhere you see a black circle is a fibroid. There's a fibroid here, here's one, a couple others here, and then a very big one right here. So patients come in, they'll get evaluated by an MRI, and they'll bring those images and we'll look at them, and then I'll talk to the patient about her symptoms and make sure that the symptoms and the imaging fit. Then we can discuss treatment options, and oftentimes that includes uterine fibroid embolization, UFE. Morning.
Hey,
How are you?
How are you?
Once the procedure gets started, it takes about 30 minutes or so. So it goes by pretty quickly. Most likely you'll sleep through the whole procedure. That's most likely. But one of the most important differences between this and surgery, because this is not surgery, the UFE procedure is safer than surgery, less invasive, shorter recovery, and importantly, they get to keep their uterus, which I think is significantly undervalued by many physicians. If you wake up, you won't feel anything that's going on. Just like you can't feel your blood moving around. So the procedure is without any pain whatsoever. So this kind of part is kind of the easy part, because you won't feel anything. Most likely you'll sleep through it, but you won't feel a thing.
It was a very small incision along the bikini line. Walked out of there with a couple of Band-Aids over the area where it happened. It was very simple and easy. I don't remember a whole lot about it because it was just that simple.
I went to the hospital with her. I mean, you know, I think a couple hours it was over.
I went into the room and they said, okay, we're gonna give you this. And I said, okay. And then I felt like 2 minutes later I woke up and I was like, when are you guys gonna do it? And they were like, oh, it's done. I was like, oh, okay.
I'm glad that it was as simple as that and not like a major surgery.
Now after the procedure, the pain will set in, today being the most discomfort and pain that you'll feel, and that each day will get better than the previous one. UFE is completely non-surgical, so there's no cutting on the patient, no large surgical wound or incision, no general anesthesia.
The UFE procedure, it sounds too good to be true, but it really is true. It's an outpatient procedure. Went in early in the morning. When I woke up, I was like, did you guys do it already? And they're like, yeah. And I saw literally just like it said on the website, it was just a little bitty Band-Aid where they had gone in.
In my mind, I thought I was going to stay in the hospital for at least 2 days so that I could get some rest, but that was not the case. Dr. Lipman told me that I would be coming home later that day, but I was just amazed that I could see him while he was performing a procedure. And I remember being taken into the recovery room, and they told me that it would take a few weeks before I was up and running. But I remember it only took me about 2 weeks.
I believe I scheduled it about a week later. I mean, I didn't wait long at all. Went in, it's a quick, easy procedure. Literally 3 hours later, finished.
The procedure works by cutting off the blood supply to every fibroid in the uterus. So it doesn't matter how big they are, how many you have. You can think of the uterine blood supply as branches of a tree. There's a uterine artery on each side, and each of them branch just like a tree, getting smaller and smaller branches to get out to the leaves. The fibroids are the leaves of the tree. I know what size those tiny branches are, and I can flow direct particles to cut off the blood supply to every fibroid in the uterus. So the big trunk, the main branches of the uterus, stay open, so the uterus stays alive, but every fibroid dies off. As these fibroids die off, they soften and shrink, and as they do, a woman's symptoms start to disappear.
Morning. Starting to feel a little different.
But you'll be feeling better in a little while.
Okay.
We'll wait and come down on the next one. Okay.
This is looking straight at her. And you can see as I page through, here's her bladder. The white is the cavity of her uterus. This is all uterus. It's enlarged. Here's her bowel. Here's some blood vessels, more bowel. Here's her right ovary. But this is all uterus here. And within the uterus, the reason why it's enlarged, there's a big fibroid on that right side. Here's the cavity of her uterus, which is being pushed leftward by this big fibroid. So likely when we go in, the right uterine will be probably the predominant blood supply to this big right-sided fibroid. But we look at both sides. It's about a 30 to 45 minute procedure. Typically the patients sleep through it, but they're not put to sleep. No general anesthesia. The anesthetic is IV and local. So often they just sleep through the entire procedure. But unlike surgery, if they wake up during the procedure, no problem. Just like you can't feel your blood moving around, you can't feel what I'm doing. So the first thing we're going to do is gain access like we talked about. You're going to feel some pushing, and then I'll tell you before I put the numbing medicine in. This is the local anesthetic. You're going to feel a needle stick. That's the numbing medicine. That'll numb up real quick. It's just an entry point, an easy entry point into the body. So if you, at the top of the right leg, if you kind of trace the undergarment line, at the top of the right leg where the undergarment would touch the top of your right leg, and you press in the right groin area, you can feel your pulse. That's where we go in. So that's our entry point into the body. So we'll just make a little incision in the skin here. You can, instead of going up to the heart to do a heart catheterization, we stay in the pelvis, obviously, and we can catheterize each of the uterine arteries separately. There's a uterine artery on each side, a right and a left, and they each branch, just like a tree, getting smaller and smaller branches. And I can negotiate a tiny catheter that's smaller than a piece of angel hair pasta under X-ray guidance. This little tiny hollow tube over a guide wire goes into each uterine artery separately, and then we can flow direct these tiny particles to go out and plug up the tiny branches to each fibroid. So the needle stick just for a moment. We put a guide wire up. You can see the artery, or the guide wire going up the aorta. That's the main artery of the body. Now we're going to advance a little straw inside. That's our foot in the doorway. So we can go in and out, change different catheters over this guide wire because we have this foot in the door. And we're going to put that pigtail catheter up. Now we're going to inject some contrast. Just kind of take that road map picture in just a moment. And there's my pigtail catheter. Okay, we're going to step out and take our first picture. As we suspected, that right uterine is bigger than the left in supply. You can see it's how big it is. We're going to go in that right uterine first. So you can see the pigtail, you can see the right uterine here, the left uterine here. Right uterine is bigger, and that's no surprise because the big fibroid's more on that right side. So now we're going to exchange for a catheter that helps us select that right side. So we swap out the pigtail for this right-sided catheter. And it's nice to have that little straw in, that way we can change catheters during the case. Okay, so now we're in the right internal iliac artery, and one of the first branches off of it is going to be that uterine. We'll take a little road map picture. Okay. So you can see there's that right uterine origin. That's the vessel we're going to try to get into. This is our microcatheter. This is the actual catheter that's going to go into the uterine. It's much smaller than our delivery catheter, and that's helpful because the vessels, when they get small, they can get spasm, and then you can end up under-embolizing the patient. So this small, tiny catheter really works great. There's the guide wire, and we put a little shape on it. Comes from the manufacturer straight. Shape to it. That way we can steer it. The Now the guide wire is going into that right uterine. You can see as I'm advancing it. I'm going to now fix the wire and advance the catheter over it. You can see the end of my catheter following the guide wire all the way around. Now we're going to get a roadmap of that right uterine. Under X-ray guidance, this little tiny hollow tube over a guide wire goes into each uterine artery separately, and then we can flow direct these tiny particles to go out and plug up the tiny branches to each fibroid. Later in the run, you see more branches. I mean, there's a really big fibroid right here. That's the dominant fibroid we saw in that MRI. You see all the little branches that are feeding. So that's what we're going to embolize. And you can kind of see the big difference. You don't see any of those little branches anymore. And now we're going to switch catheters, go to the other side, which should be the smaller of the two, not as contributing as much. So we're going to take out this catheter, this is the right-sided catheter, and exchange it for the left-sided catheter. Now you can see here's that left uterine. That's the vessel we're going to try to get into. You can see my guide wires above it. We're going to try to get into that origin and advance it into the left uterine. Kind of turn it. It's in the origin now. Sometimes it's kind of up and over. Just like the right side, we're going to take a before picture for the left, just like we did for the left. You can see our catheter here, the bladder's filling up with some contrast down here, and then this is that big fibroid. You can see those branches going up to feed that big fibroid, most of which was from the right, but it still has a number of branches, as you can see, from the left as well, so we're going to embolize those. What was the start time? 8:21? Yes. Okay. And stop time is 8:57. We see everybody back 3 months after the procedure, and by then she will definitely be able to say that things are better, we hope. Better, lighter flow, her periods are lighter, her pain is less or gone, and her urinary frequency is less or gone by then. So all the symptoms, hopefully, will be dramatically better by the time I see her 3 months from now. Now what we're going to do is just put a closure device to seal the opening where we went in. To do that, we have a closure device. Basically, it's a hydrogel that is deposited just under the skin outside of the artery that seals the tract. So these patients can get up. She'll be up and walking around 2 hours from now. Versus if we just held manually, she'd have to be in bed for 6 hours. So this allows people to get up and mobilize much quicker. When we're done, we take that little catheter out and put a Band-Aid. No stitches, just a Band-Aid covers the opening, and that's it. It just tests to see that we're in the artery, and we are. And then we pull it back. The balloon is up against the inside of the artery, so now we can place the hydrogel outside of the artery. That's really important, obviously. I'm going to take the device out now. We hold for 1 additional minute, and then put a Band-Aid on there, and that's it. The recovery period is on average about 4 or 5 days, out of work 1 week. But I've had people breeze through it, taking 2 or 3 days to recover, and I've had patients take longer than a week to recover.
My recovery has been great. I was actually up, and the very next day, moving around, less than 24 hours. No complications at all.
There was no recovery. I was just fine. Came home. I was told not to go to work. I believe I had it on a Monday. I was told not to go to work that week. I think I went back to work on Thursday.
I was given 10 days for recovery. Actually, I didn't need 10 days for recovery. The biggest problem I had was my husband telling me I needed to rest.
What was funny was that when we got home, she was feeling great and she was ready to go out and start doing things. I'm saying, no, you can't do that. You got to rest up.
My recovery period was not long at all. I had the procedure. I was probably down for maybe 3 or 4 days, and then the following week I was back at work.
I actually was filming Real Housewives like 2 days later. Nene came to visit me, and I think it had only been 2 days since the procedure. I mean, it's over before it even starts, and you get your life back. No scars, healing time is short. I almost feel like I felt better.
My monthly cycle is much lighter. I can definitely tell the difference. I am not bleeding through clothes anymore or changing out my pads every 45 minutes. It's not completely back to normal, but it is definitely in the process.
I didn't have any pain or any discomfort that I can remember after the procedure. No pain. I didn't have to take pain medication anymore. I remember being up and around.
I think I was out of work maybe 2 weeks, but 1 week I sort of wasn't working, in bed recovering, but then that second week I was working from home. So I was actually up sitting at the computer working, and then after that I was ready to go back to work.
After the procedure, there was no pain, no complications, nothing. This procedure gave me my life back.
I am back to my own self. It's been 3 to 6 days. I am back at work full time, actively moving around. I feel great. People have actually told me that I look better. I have my life back. What can I say? I have my life back, and I'm very, 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 very happy about that.
Yet every day in the office we see patients that say they never heard about this, they were only told about hysterectomy or surgery of some sort, never heard about this, and so we keep trying to get to a point, the tipping point, I hope, that I don't have to do this anymore.
Uterine fibroids have not been the topic of many conversations among women. Publicly, they just don't discuss it and find it difficult for others to relate. Fibroids to Fabulous is one of the many events that educate and inform women about uterine fibroids and the choices they have for a cure. On the forefront of this event, Dr. Lipman encourages women to consider the UFE procedure. Events like this shed a light on the hidden subject matter and make women more comfortable to talk about uterine fibroids.
They didn't want hysterectomy. It was the only option that they were told. No other option. They didn't want surgery. They didn't want to lose their uterus.
Dr. John Lipman is making a lifelong commitment, making sure that these silent sufferers know about UFE, uterine fibroid embolization.
Wearing white pants is symbolic. When women are struggling with fibroids, they're not able to wear white pants.
One time I was at a gymnastics meet with some friends and had on white pants. And all of a sudden I realized, oh no, and I didn't have anything with me. And I felt this gush. It was horrible. And I had to tie my sweater around my pants to get out of that gym. And I never wore white pants again.
Professionally, I am a nurse, and at my facility, our uniform is white scrubs. So you can imagine every month it was like a nightmare thinking, here I go again with these white scrubs, what am I going to do?
I remember when I first met her, I went to her house. She had brown sheets and deep purple sheets. And I'm like, well, you don't have white sheets. She said, no, that's because that's what she likes.
I can't walk down the street without, women coming up to me saying thank you for talking about it. Since I saw you talking about it on Real Housewives, I decided to do something about my situation. I'm really glad that I fought them to film my whole fibroid journey. I mean, I'm on many platforms talking about fibroids. I actually consider myself a fibro lady now.
I was excited, you know what I'm saying? Because now I know she's getting fixed, and she could send a message, and that's the reason why I'm here. To send a message to others, how to deal with this.
I've told a lot of people about it. I've actually even told my parents live in England. I've told them about it. They've passed it on to others. I went on to Good Day Atlanta with Dr. Lipman and got interviewed with him. I love to talk about it now and to tell women about it because I don't think a lot of them still know, and I don't know that their gynecologists are telling them.
I always tell women about the procedure, that there's another option out there.
I have 5 sisters. I have 6 sister-in-laws. I have 5 granddaughters. And I wouldn't want them to go through this. And so it's very important to me as a man, to help spread the word and let other people know that this is very debilitating, and that we should do all we can to make people aware and educate them on fibroids and the different options there are for eliminating them.
I would tell women who are suffering You're not suffering alone. There are a lot of us who have gone through it, and now we can talk about it, and we know more, so we can share that knowledge with you guys to let you know that there is another option. You do not have to get a hysterectomy.
The UFE procedure changed the lives of these women. Although they were from different walks of life, experienced different stories, they could relate to the same haunting problem that now is in their past. They're free from isolation, free from having to put their life on hold during their menstrual period, free from planning their life and work around their period, and free from the embarrassment for the times which planning could not contain. Thanks to UFE, they now are truly free and live a completely normal and active lifestyle.
I think the message I would leave to other women who are going through a situation where they have fibroids and are trying to figure out what to do is to really do that research. I felt very safe going through the procedure with Dr. Lipman, and he did an excellent job. So if that's a concern, I don't think anybody should be concerned about that.
Dr. Lipman's procedure, it works. My wife had uterine fibroids, and we didn't want to get pregnant and do other options until we found a solution in order for us to have a baby. And once we had the procedure, we waited a while, close to a year, and we tried to get pregnant, and this is the result. It works.
My life is so much more full and happy. I have a lot of energy, I've lost a lot of weight, I get to go out with my friends and enjoy life like I was before I had the fibroids really badly. So Dr. Lipman actually gave me my life back, and that for him I'm grateful.
Anybody who is experiencing this, they need to go and see Dr. Lipman and get the UFE procedure right away. It will change your life. It's absolutely amazing.
UFE is out there. It's fantastic. It's easy. It's non-invasive. You recover fast, and it changes your life. And you get to keep your uterus.
It has been a blessing. My anemia is going away. I have energy. I have normal menstrual cycles, and I kept my uterus. And I want you to do that for yourself. Seek the options. See what is out there for you.
I hope people learn from this, that there is this great option for you. You don't have to suffer anymore.
I talk about it all the time. I want to free people just like I feel like I freed myself.
You've heard and seen their stories and witnessed how the UFE procedure has changed the lives of these women and thousands of others. Not only have they left behind a world that kept them captive, but they regained their freedom in being able to do things that they were not able to do before UFE and now no longer suffer from. Some of these women have shared their stories with loved ones, friends, and colleagues, while others have become a vocal force behind the awareness of this movement. Because of the UFE procedure, uterine fibroid embolization, these women no longer suffer in silence.